Well, my name is Dr. Nicole Sparks. I'm a board-certified OBGYN and mom of 4. I'm a big advocate for maternal health, especially when it comes to pregnancy and postpartum care. Outside of medicine, I do a lot of lifestyle content. It's been 6 months since I became a mom of 4, and one of the biggest things I have learned is that we are way too hard on ourselves. I love teaching women how to advocate for themselves and show women that we can really have an intersection between motherhood and career, and you really can do both and you don't have to choose. I'm really thankful that I get to show my community of women how to balance career and family.
Seeing her be able to navigate being a hard-working woman at the same time a beautiful mother, it's just something which it awes me.
I've performed hundreds of C-sections over the years, but it's totally different when the doctor becomes the patient and you're the person on the other side of the curtain. But because of previous surgery, I was pretty much mandated to cesarean deliveries. And even though I was so excited about my baby, I just remember the recovery being really rough.
Pain sucks. And, as a husband, watching her go through that, it hurts.
I definitely struggled in postpartum because I was taking opioids. I just was foggy and I just felt really disconnected. And so I knew that I needed a different experience for my next C-section. I talked to my doctor during my 3rd C-section about Exparel, and I noticed a big difference in my recovery, just the way I was able to move about sooner, going up and down the stairs, being present for my other children, and especially being present for my baby. But honestly, this is probably the best I have felt after a C-section, and this is my 4th one, where I didn't feel foggy and sleepy and fatigued and constipated and all the side effects that come along with using opioid pain medications.
Seeing her able to bounce back in such of a way that allowed her to be her. Oh, it's such a blessing.
I'm just so thankful that I learned about Exparel, that I use it on my patients, and that, I was able to also use it during my C-section. This is my Exparel story. I encourage you to share yours.
Indication and important safety information. Exparel is a one-time injection into a surgical area in patients 6 years or older to reduce pain after surgery, and in adults as a shoulder nerve block and leg blocks to reduce pain in a specific part of the body. Safety and efficacy in other nerve blocks are not established. Exparel may cause a serious condition where too little oxygen is delivered to blood cells. Get immediate medical attention if you experience pale, gray, or blue-colored skin, headache, rapid heart rate, shortness of breath, lightheadedness, or fatigue. Temporary loss of sensation or motor activity that may last up to 5 days can occur. In adults, the most common side effects are nausea, fever, constipation, headache, and vomiting. In children, the most common side effects are nausea, vomiting, constipation, low blood pressure, low number of red blood cells, muscle twitching, blurred vision, itching, and rapid heartbeat. Tell your doctor if you or your child has liver disease, since this may affect how the drug is eliminated from the body. Please see full prescribing information at exparel.com/prescribing-information.pdf.